For the session. Thank you. Are there any objections to recording this session? If not, we'll proceed with the recording.
No projections. Aaron, just as a heads up, though, we were seeing the presented version of the PowerPoint, like the
Yes.
just the other one. Yeah.
Thanks, Max. And it's still doing that. Okay, one moment here. Just need to get my presentation up properly. Sorry about the delay. Okay, there we go. So thank you to everyone for joining our session today. Today we are going to be talking about the BC Cancer Prince George telephone line care clinic. And at the beginning of this presentation, I do have a couple of questions for our Prince George subject matter experts, which I'll get to in a minute. But first of all, just thank you all for your time and for attending this session. I'd like to first acknowledge with gratitude that we're gathered on the traditional, ancestral, and unceded territories of the Lheidli, pardon my mispronunciation, Lheidli First Nations, who have nurtured and cared for the lands and waters around us for all time. I give thanks for the opportunity to live, work, and support care here. Many of us are connecting from other areas of the province, so please just take a moment to also acknowledge the lands that you reside on. Just a couple of virtual meeting tips. If you could hold your questions during the demonstrations, or maybe raise your hand, and if I see and I can come to a natural stopping point, then I'll do that. Please do state your name when speaking. This helps us with our notes and collecting information after the fact. Please mute yourself when you're not speaking, and you can feel free to add any non-urgent questions to the Zoom chat. If Rena, maybe you could just keep me honest. If there are questions in the Zoom chat that I don't seem to be seeing, then just if you could point them out to me, please.
Sure, no problem.
Thanks. So this session will be recorded, and recording has already started. So first of all, we'll go through brief introductions. We won't introduce everyone on the line. So if you could all just be prepared to enter your name in the chat, and that will again help us with our note-taking and attendance record keeping. We're going to do a high-level review of the telephone line care workflows. I'm going to do some demonstrations in Cerner, which are going to include outgoing calls, incoming calls, and address the 24 to 48-hour call, which I hope I'm using the right lingo for Prince George. We're going to go through some requirements gathering and then a session recap. So at this point, I'm going to introduce myself first. I'm Erin Dykstra. I'm a registered nurse by background. I was working for BC Cancer in Abbotsford in the radiation therapy department. I've been with the CST team now since 2019 with a little bit of a COVID hiatus, but I'm happy to be back with the CST team and working now with the BC Cancer CST implementation team. Rena, I don't know that you need to, well, actually, Rena, if you could introduce yourself, that would be great.
Oh, yes. Hi, everyone. This is Rena Ben-Marito. I'm a new CIS with BC Cancer here in Prince George. Thank you.
And I'm not sure if Arlen is on the line. I can't see the whole list. Arlen is, oh yeah, Arlen is there. Arlen, if you don't mind introducing yourself.
Sure. I am the senior leader for BC Cancer Clinical Informatics on the implementation side of things.
Thank you. And I think I saw Felsie.
Hi. I'm
Hi,
Kelsey. I'm the clinical nurse lead for the ambulatory care in Prince George. And I have Sam Batty with me, who is the SME frontline nurse for TLC.
Okay, thank you. Welcome, Kelsey and Sam. Sam, you go by Sam? Okay. Is Megan on the line today?
Hi there. Yes, I am on the line. I am the senior practice lead for nursing at BC Cancer Prince George. I see on the slide I'm listed as /CNE, but I'm actually just FPL now. I'm not filling both roles anymore.
Okay, great. Thank you for that clarification. We do have a few guests from Vancouver. I can see that Anna, you've put in your name already. Are there any other guests from the Vancouver Center who would like to introduce themselves? All right.
Oh,
go
sorry,
ahead.
Erin, it's Stephanie. I thought I would introduce myself to Kelsey and Sam since we might be connecting in the future. I'm Stephanie. I'm one of the informatics specialists in sustainment at BC Cancer Vancouver, and the primary part of my portfolio is nursing. So you will probably be connecting with me in the future. So nice to virtually meet you for now, and I'm sure we'll meet in person over the summer.
Perfect. Thanks, Steph.
Thank you, Stephanie.
Is there anyone else who would like to introduce themselves verbally as opposed to in the chat? Okay, as promised, I'm going to stop my video now for the remainder of this session. It just helps me to be a little bit more comfortable, especially using this new platform. Zoom is relatively new to us, so thank you for not objecting to me turning off my video. So first of all, I'm not going to spend too much time on these introductory slides just because we do have a bit of a time crunch as far as, I've got you guys for an hour and would like to respect that time and not go over. So first of all, what is a subject matter expert, or as we start to call you, a SME? The SME is a person who contributes as an expert representing your specific area. And we like you to be an expert so that you can discuss the workflows and recommendations for future state workflow. You would understand and think logically about the processes and workflows within the clinical setting, and you're able to consider the requirements and needs of the stakeholder groups across all health organizations. So I think there is for me anyways, personally coming from BC Cancer, I tend to think a little bit more specifically about BC Cancer, but we're asking you to think a little more globally about the what we also call VPP, which is the Vancouver, Providence, and Provincial Health Services Authorities groups. So enterprise, we say enterprise a lot, and that just means all of the health organizations that are represented under CST Cerner. So you would be familiar with your health organization policies and documentation and be able to confidently make informed decisions within your area of practice. So as SMEs, you've been selected by your center to help make these decisions. So you've been empowered by that, by virtue of being selected to help identify gaps and understand the workflows that are being presented here. Any questions about being a SME? Okay. And next slide, so the purpose of this session is to view the enterprise workflows for telephone line care and identify any gaps in relation to Prince George clinics. We'll validate content if we're able, and just as a caveat, there will be some scheduling pieces that will appear as gaps at the moment, just because those scheduling locations have not yet been built for Prince George. So rest assured, we do have more sessions coming specifically related to scheduling. A brief overview, I can attach these slides to the meeting invite if anyone does need to review them after, but really just the purpose of CST Cerner is to improve patient safety, improve the delivery of evidence-based care, create less chase time, more face time, so less looking for charts because it's all on the system, on the computer. We draw on available data to improve the the system, but also it makes high quality data readily available to us in the future. So having an electronic medical records system does help us to improve services as well, and to strengthen our core. So improving the reliability and stability of the technical environment and reducing clinical information system maintenance costs. Those are future goals. These are just a few of the Cerner applications at a glance. Not going to dig too far into this slide. We'll be mostly looking at power chart today, but we do touch a little bit on this scheduling appointment book when I talk about the clerical role. Guiding principles. We're really looking not to make change for the sake of change. We would like to be able to fit as much as we can into the enterprise workflows for telephone line care. And our focus is enterprise design. So meaning, once again, we're looking at what's good for the broader scope of the enterprise, BPP, where possible, and localization when it's required. So I already referred to the scheduling build that will need to be done for Prince George. And then number 3, our focus really is on must-haves. So things that are a must-have are those things that have implications for patient safety, whereas a nice to have is something that we can actually work on after we've gone live with CST Cerner, and we can actually optimize at that point. So really we're focusing today on those must-haves. Are there any questions before I continue? Okay. Hearing none. I have some questions for the Prince George group before I continue. And this is just going to help me to maybe tailor my presentation a little bit, although you will see some of my the unknowns that I had coming into this presentation may be represented as I go through. But first of all, if you could let me know, the PRISM form, where is it completed currently?
So we have a couple of places where we do. The majority still done in general clinic, but definitely not in TLC.
Definitely not.
Yeah, and so we do the PRISM currently in team-based care and RT nursing.
Okay.
And then we have like a ST nursing as well, but that's only in the general clinic, not the chemo area.
Okay, and so for the ST nurses or the ST, I guess, side of the equation, most of those would be done in general clinic space during the team-based care?
Yeah, general clinic and team-based care.
Okay, and does the patient complete it, or is a nurse with the patient during the completion?
Well, if the patient is present in person, then the patient completes it. We try not to do too much on paper because then it will be like another extra work for us to transfer onto the online version, right? So very rarely do we do paper form unless we are faxing to our host hospital. We do have like inpatients admitted, so it is difficult to do over the phone just because of like, you know, how well they are. So we do fax a paper copy over to the host hospital for the nurses to have that completed.
Okay, and that is, sorry.
Yeah, and then so again, mostly the patient does if it is an in-person, and for out-of-town patients, then the nurse goes through the questions and completes that for them.
Okay, are you still referring to the PRISM form, or have I skipped you ahead to the BC transfer form?
No, just the PRISM, yeah.
Okay, perfect, thank you. Just wanted to make sure I was understanding. Okay, so then now we're gonna go to the next question. At Abbotsford Centre, we often called it the 24 to 48 hour call, but this is the phone call that's made when patients are admitted to an inpatient space. Who's currently completing that?
So that is done under in general clinic.
Okay.
By RT nursing, and sometimes the SD nurse does, depends on availability.
Okay, all right. And do you divide the workload based on whether the patient is coming in for a systemic therapy versus radiation therapy? Or is it just done?
Not generally, just done mostly in the general clinic, yeah.
Okay, all right. So you will notice that piece of my presentation is based on the assumption that the BC Cancer Transfer Form is completed by telephone nursing care, but we can just consider that to be any kind of pre-booked outgoing call.
Okay.
And do you ever receive patients from sites that are live on CST Cerner?
I think so. I mean, in the sense that some of our patients do go down to Vancouver where they are using the Cerner. So yeah, so I don't know if that answers your question.
Yeah, and I think I need to clarify my question. It's actually asking if you receive patients who are admitted at a site that's live on CST Cerner, so a hospital facility.
No.
No, that was my assumption too, but
No.
wanted to make sure.
Because usually when we get the Vancouver patients, they're like home before we get them.
What about the ones admitted to UHNBC? Is that a different? Our host hospital, UHNBC, would that be a different Cerner?
I
It
think
would
it's a
be.
different Cerner, Phelps.
Okay.
It's not,
Okay.
yeah, not the same.
Okay.
Yeah, exactly. So thank you very much for those, for clarifying those things for me. So now I'm going to jump into the workflow. So our understanding is that there would be incoming calls and outgoing calls. So in current state, you would receive a call to the phone line. You probably let it go to a voicemail first, and then triage those calls and return the call. In the future state in Cerner, we're able to do that as well. And this diagram and chart is just showing how we can do that in Cerner. And I'll show you a demonstration of that in a moment. Is my first assumption correct that you would allow the patient's phone call to go to voicemail?
No, this is just Sam speaking. I'm the RN here. And no, that's not always true for us. Like if we're not busy and the phone is ringing, a lot of us will just answer the phone as the incoming call comes.
Okay, all right,
Yeah.
that's perfect. That's not going to make or break the workflow. It just means that you'll be looking up the patient in real time as
Yeah.
opposed to looking up the patient at this step, really. So
Okay.
that's good. Thank you. All right, so essentially what the future state workflow looks like is if you receive a call from a patient, if it's gone to voicemail, you'll put it into a message center reminder, which I'm going to show you in a moment. Message center is a tool within PowerChart that's used to communicate messages between either between clinicians who are part of the same group or clinicians who might be part of two separate groups, such as nursing and clerical being a separate group. So when the nurse starts their day in telephone care, they would opt into whichever message center pool is relevant for them and their assigned tasks for that day. They'll listen to the messages and create that reminder in the message center pool to call the patient back. When you return the call, you do your assessment, you complete a nursing note, and if you need to, you can complete a reminder to call the patient again, or we can actually add an order which would go to the clerks to schedule a follow-up call. I believe, once again, the understanding is currently nursing does all their own scheduling. Yes, okay. And that is somewhat possible still in future state. Well, it is possible, sorry. It's just the method by which it's done would be quite different, whether it's actually scheduled versus when the nurse completes a reminder in the pool, which I'll show in a moment. And the document note type that will be used when you do document the call is ONC phone nurse incoming call note. And then there's a specific template that can be used, clinician telephone note. So just before I proceed, a word on encounters. You've probably heard a fair amount about encounters as of already within Cerner. And so part of the challenge is we don't want too many extraneous encounters being created. Multiple encounters can create some confusion. It makes it a little bit more difficult to choose the correct encounter when scheduling things. So, we want to choose an existing encounter if at all possible. So for telephone care, there will be occasions, could be occasions, where the patient calls in and they're chart is not already associated with an encounter. So the nurse, when they open that chart, they need to choose the correct encounter for that interaction. So we can see here the first choice, and let me just move that away. The first choice is if the patient has an existing pre-outpatient or pre-recurring encounter, then you would choose that encounter. So if the problem that they're calling about is related to their systemic therapy, then you would choose a systemic therapy encounter that is either pre-outpatient or pre-recurring. So if it's related to their chemotherapy specifically, you'd be choosing the pre-recurring encounter for chemotherapy. Second choice is very similar. It's just assuming that there's just an existing recurring encounter. So again, if the patient has already come for chemotherapy, that recurring encounter has been flipped already from what used to be a pre-recurring encounter to a recurring encounter. I'm just going to pause to assure you that you don't have to remember all of these details right now. I take on a bit of a teacher mode when I'm doing these presentations, and it may sound like I'm trying to teach you something that you're supposed to remember in the future, but you're not really. Just to give you some details is all this is. And then we also have a third choice, which is if the patient does not have any upcoming appointments, they may have a previously discharged encounter that we can actually use to document on. The last choice is to create a phone message encounter, and that's really only to be used if there are no other encounters available that are appropriate. And when I speak about encounters, I am talking about the encounters within your facility, which you could have patients, obviously, as you said, who are coming from Vancouver Centre. So you would not want to choose a Vancouver Centre encounter. You would want to make sure it's Prince George. Okay, so I'm going to dive into the demo here in just a moment. But first of all, just to give you a little bit of context to the incoming call that I'm about to demonstrate. So we're going to assume that this patient, PG Demo Malbec, has contacted the PG TLC nurses. He's experiencing nausea and vomiting, which began on Sunday. In this case, you've listened to his message on the voicemail and will place a reminder message in Message Center so that you can triage all of your messages that are coming in. After completing the call, you also will decide that he requires a follow-up call on Thursday, so you're going to put in that scheduling request. And just bear with me while I exit the PowerPoint presentation and get PowerChart up and running. So now I'm in PowerChart. I'm logged in as an ambulatory RN, which is the provisioning that the nurses will receive. And the first step that I need to complete is to opt into the correct pool for the day that I'm working. So you can see in Message Center, I'm in the Pools tab, and I'm going to manage those pools. I'm going to look for from a list of available pools. Today we're using Vancouver Centre locations because the locations for Prince George may or may not all be built or may not be functioning as we expect. That said, sometimes the Vancouver locations aren't functioning either, so you might see a couple of those things come out in this presentation too. But just to note that we're using Vancouver today as being the most reliable. So I'm going to multi-select here so that I can, oh, can't do that. I'm going to opt into the Oncology RT telephone line and the Oncology ST telephone line. So this is where we do have some questions later in this presentation as to whether or not you would require two separate categories for your site. Once I've opted into those, it will save, and then I can go about my workday. So Mr. Malbec has called in. You can search for your patient via various means. If all you have is their name, you can start by searching there. I think oftentimes the outgoing messages will ask patients to leave their BC Cancer ID number, which if that is the case, you could confirm their BC Cancer ID number in this field here. My patient does not have a BC Cancer ID number, so I'm just going to be opening them up from this window. You can see this is one of my play patients, and they have a lot of encounters on them already. So you can just, at a glance, you can see the importance of choosing the right encounters. For today's presentation, I'm going to say that their concerns are related to their chemotherapy. We'll disregard this pre-recurring and actually use this recurring encounter for medical oncology. And every time you open a patient's chart that you haven't been in for, I think it's 12, maybe 24 hours, then you're asked to assign a relationship. And that just indicates to the system that it helps with tracking to ensure that people are entering patients' charts for the right reasons. So today I am the nurse. Now that I'm here, I've got the patient's chart open. I'm going to create that message center reminder that I talked about. Going up here to to communicate, I can click this little down arrow here, and I can create a reminder from within the patient's chart. When I do it from this location, the system automatically inserts the patient's information so that this is immediately associated with the patient that I am caring for. The pool, I'm going to be sending it to the BC Cancer ST pool. And then I can change this title here to something a little bit more appropriate that gives us some idea of what the patient is calling for. Okay, at this point, if I wanted to also let the physician know what's going on, I could do that. I probably would not do that at this point though, because really what this is a reminder to yourself or the other nurse working with you that this patient needs a call back. And Felsie, I see your question, who is in the pool? It's really whomever is operationally determined needs to be in that pool. So again, we'll get to some questions about Prince George specific toward the end of this presentation, but just keeping in mind that it's really operationally decided. So I'm just going to type a quick note about why the patient called. This, as you can see, currently is not going into the patient's permanent record. If I were documenting more and I wanted it to go into the patient's record, then I would click this square here to save it to chart. But I'm not going to in this case. So now I'm going to send this message. So we're going to give the system a minute to catch up with me, but generally speaking, when we go to Message Center, we should be able to now see that message. It will take a couple of moments, or at least it did when I've tested this previously. While we wait, are there any questions?
Just as context also, Erin, I think the default on reminders is set to 1 minute in the future. So it's actually not the system slowness, it's actually defaulted just to take 1 minute to do that. You can also make it immediate too.
Okay, yeah. All right, thank you for that, Max.
No problem.
Well, that would be why it'll take a minute then, a hot minute sometimes, but and of course, the more I click, the more impatient I feel.
Erin,
so, yes.
I think you have to go under work items reminders. At least that's where we see our logged communications. Oh, it's not there.
Yeah, it's kind of funny because it should show up here, and then yeah, as a sub folder, it will show up in reminders.
The way we do it in Vancouver, we're told to go under reminders and then click the communicate drop down and set reminder. And then we look up the patient info using the binoculars icon.
Right, yes.
Yeah.
Yeah, and for sure, that's another option. Like because the way I showed might actually be less, it might make less sense workflow wise. So definitely, Anna, that's good feedback that you can be in Message Center and create the reminder directly from there.
Aaron, maybe just try sending another one. I think it may have been that the TLC pool, we looked for it, but I don't know that we actually selected it as a recipient. So maybe we can show this way how they do it in Vancouver.
Oh, did I? Okay. Okay. Sure, then I'll do that. So again, you can see the same kinds of things pop up. I'm gonna change the subject line to differentiate it from my first one. And we'll just call it second test, very creative. And maybe I'll show up in 0 minutes, if that will work. Right, recipient. Okay, now I know that I have a recipient. We have a title for this, and perhaps I need to enter something into this window again.
Erin, my apologies.
That's okay.
Did you want the on treatment clinical or the ST-TLC?
That's the one. Thank you. Thank you, Candace. So we should be able to find the ST pool. Yeah, that's exactly the problem, was that I chose the wrong pool. And the reason I chose that is because we could see how this functioned very much like Outlook, where it starts to fill in after you've indicated a few search terms. And so that's exactly what happened here, was that I chose the wrong pool, thinking that I was choosing the correct pool. It's interesting that I still cannot send this message. So
I think if you put in one,
there, yeah, it didn't like 0. So now we'll be just waiting again for a minute for this one to show up, because again, I didn't send it to the right pool first time around.
Just while we're waiting, as another quick tip, if you just go to send another reminder, Aaron, you can also save recipients as favorites. So if you've ever searched through that pool function once for someone, if you just look for one again or start typing, if you double click on one of those and then right click on it, you can add as favorite. So then that will be in your personal address list. So every time subsequent, kind of like Outlook, you can just double click down below from the personal address list and that would add it. So you don't have to deal with any search functions.
Perfect. That's great.
Hopefully.
So yeah, we can see that I've added now both of the telephone nursing lines for Vancouver Centre.
Erin, there's just a quick question from Suminder.
Yeah.
He's asking, can you change the show up from minutes to seconds?
Yeah, I wonder, we must be able to do that. Nope. Minute, hour, day, week, month, year. It was a good try.
There you go.
If this persists in not showing up, which it seems it is, I will carry on.
Actually, if you just click on reminders now.
There she is. Okay, thank you. Yeah, so I was incorrect. It does not show up just in results. You have to click on the reminders. Thanks, Max. So now we can see the patient in our reminders section here in Message Center. What this allows the nurse to do is, if there's more than one of you working in the clinic, or you have multiple patients that you need to triage and prioritize the return call, then you can have them all in here. And when you're ready to return this call, you can actually open this, right click on this item on the patient, and you can assign it to yourself. So if I were logged in as myself right now, when I assign this item, the name that would show up here under assigned would be my name. Of course, because we're in the build system, we have kind of long and crazy names, but this would be now assigned to me, and that would indicate to my teammate that I'm going to complete this call. So now I can go into the patient's chart and I can complete the call. So not completing the call yet, sorry. I'm actually just going to go to their chart, look up the patient, gather the information I need, give them a call back, and then enter any relevant documentation. So as I already indicated, we do have specific note types to be used in telephone care. And what these note types do is they just help you when you're creating your documentation. They give you a template to work from, which most of us will recognize. This is very similar to the current telephone documentation form, or TDF, that BC Cancer uses at this time. So here I can just enter a quick note about why the patient called. I can put in the phone number from which they called me. And the time of the call. And the time that I returned the call. And then the data, action, response, and plan. So I would obviously enter my relevant assessment data into this form. When I'm done my documentation, I click on Sign and Submit to save it to the patient's permanent record. As I do that, once again, a window opens up, allows me to change the title of this note. So I could change it to, and this would be operationally based as far as what kind of titling you might want to use for telephone documentation. You could also just leave it as clinician telephone note. And then if I wanted to CC the provider on this, I could do that as well here. So let's say I want to copy Dr. Lily Lee on this note, then I can do that. And then when I click sign, then it actually becomes part of the patient's permanent record. And if I go to the documentation section here in the menu, I can see the note that I've just created. Any questions about this part of the workflow?
It just seems a lot of steps, that's all.
Yeah, for sure it does. And this is where, you know, operationally you can decide, do we want to use this reminder message or do we want to keep picking up cold calls? It's a way of organizing. And I wonder if Anna Pasco, if I can call on you, do you guys find this a good workflow at Vancouver Centre?
Yeah. So with the telephone line care, there's nurses that rotate morning and PM. So if we started at 8, the nurse would be the one logging those messages from 8 to noon. And the nurses who are in clinics, there's 8 team-based care nurses helping out. And within those teams, there's other nurses too. And they'll check the message center reminders. And the way we categorize the subject title is based on the team. So if it's a gynae patient, that would be team 2. And if it's the physician's name, we can find out who the primary is. We'll add that in. The tumor site, the nurse working with that patient, and the reported issue would be in the subject title. That way, when the nurses are in the clinic, they can easily tell if it's their patient that they need to follow up on.
Okay, that's good background. Thanks so much. Any other comments or questions before I move into outgoing calls? Okay, all right, thank you. Sorry, I muted myself by accident there. The outgoing calls are a little bit different in that, sorry, I realize I'm sharing the slides here as opposed to the presentation. So with outgoing calls, these are a little bit different in that they would normally be a pre-booked call for a follow-up, or some of these outgoing calls would come directly from PPOs. So maybe a little bit rusty, but I think there is a PPO for nivolumab that the doctor can select to have a call scheduled for assessment of that patient. So these are outgoing calls. That's kind of where they're generated from. So also we can have the nurse book the patient for an outgoing call or a follow-up call, which I'm sorry I neglected to show you in the previous step, but I can show you that in a moment. So essentially what happens is the clinician, whomever, requests a follow-up call, and then the clerk would be picking up that request on a request list and scheduling the nurse phone line call. I understand that currently nurses, once again at Prince George, are doing all of that scheduling themselves. So this is important consideration for your workflow and workload on clerks in Prince George. I'll show in just a moment the review of ambulatory organizer to see that list of patients that require a call. And then the nurse would be completing the call, creating their note, and updating the status on ambulatory organizer, which again, I'll show in a moment. At the end of the day, the workflow is for the clerks to be reviewing ambulatory organizer for these types of phone visits that are pre-scheduled, and then they would check in any patients that have been updated to the status of arrived within ambulatory organizer. I'm hoping this will all make more sense when I show it to you in system. And what could be is quite obvious, it would seem. The documentation note type for outgoing calls, very similar to the incoming calls, except that we replace incoming with outgoing. Any questions on that? So once again, I'll get Power Chart up and running here. And now, once again, I'm the nurse in the telephone care office, and I'm going to go to ambulatory organizer to see any pre-scheduled calls for the day. Currently, I do have a call. It's to the same patient to do a patient assessment. You can see I've made a note here about the transfer form, but that once again was my naivety going into this presentation. We'll talk about the transfer form at another date. So as the nurse, I'm going to go in, I'm going to review this patient's chart. I'm going to document on them, which I'm not going to show you right now in the interest of time. But those are the steps very similar to what you've just seen, only that these steps, that this patient is actually pre-scheduled. So we can see right now that the patient's status is confirmed. So once I reach this patient via telephone, I will update this status to arrived. It's going to be up to your site, whatever your current policy is, as far as how many times you call that patient and leave a message before you indicate that you've not been able to reach them. So if you were not able to reach that patient, you could mark them as a no-show. And then you would have to give a reason. So here we have what's called sticky notes. And if I couldn't reach the patient, then I would just make a note here that patient was not able to be reached. And if you wanted the appointment to be rescheduled, you could request that here as well. And save that. Since I've already indicated the patient has arrived, I'm not going to enter that note, but that's just the options if the patient doesn't. And then this is where the clerk's going in at the end of the day. They'll be able to see that the patient has arrived, and then they have the capabilities to update this to checked in, which you can see as a nurse, I don't have that ability. I just would like to show one more thing, and that is the telephone nurse line follow-up order. So orders in Cerner, nurses can place this order without a doctor's co-signature, but we will see that when I select the order, it's going to ask me for a doctor's name. So we have this order called Follow-up Clinic Nurse Telephone Line Care. When I choose that, it's asking me for a doctor's name. We use Test Alex often in our demos, and it would be no co-signature required here. And then I can select a scheduling priority. So let's say I want to have this patient phoned again in 48 hours, then I would select that. And the appointment requested would be for nurse assessment, and it's related to their ST treatment. Some of these other things, apologies, I don't know for sure if they apply to Prince George, but they are specific to Vancouver for sure. PARP immunotherapy. So I guess if it was a nivolumab call, then that's what would be indicated there.
Erin, can we actually just
yeah.
confirm if we have a moment quickly, just because this will feed into how we actually configure the order for the Prince George stakeholders on the line. I think these are particular tumor groups and or subspecialty treatments. Do these resonate with you in Prince George?
No, we typically don't book our calls according to like tumor groups or anything like that. Like it's just a general call one that we use right now or on case. Like we don't specify what their treatment is.
Perfect. Do you specify difference between RT and ST phone calls?
No, no, not in telephone line care. It's just all one system.
Yep.
Okay. Do you think that would be helpful to specify between RT and ST moving forward in terms of the different appointments that would appear?
I guess it could be, yeah.
Okay, thanks so much. Sorry about that, Erin.
It's
No,
Darlene.
that's
Can I
great.
just ask a question about that as well? I thought some of those come directly from order sets. So I guess, yeah, like those are particular chemo protocols. So you don't actually process that order, so to speak, or?
No, so those calls aren't booked to the TLC schedule in Prince George. Those are booked to like the ST or RT schedules, like those follow-up calls that you're talking about. They're not booked to TLC.
Okay, so they are booked, but not to TLC.
Yeah.
Okay, thanks.
Okay, so if you get a request for a Nivo follow-up, that would be booked to ST.
That's right, yeah.
And then that call is made out of the chemo room or where?
No, a general clinic.
Okay.
Yeah.
All right. Just going to show that signing process. I'm looking at the clock and realizing I think I'm definitely running out of time here. But I would like to just do a quick little show of what it looks like on the clerk's side of this equation. And the clerks would be doing a lot of their work related to telephone care out of the scheduling appointment book, which you're going to be seeing a lot. But this is just a quick little snapshot of what it looks like. Currently, the scheduling appointment book has not been behaving as expected in the build domain. So I'm not going to show you the booking of a new appointment. Just suffice to say that there are some steps involved for sure, which you will be seeing a lot more scheduling as we go through this process. But the scheduling, generally speaking, the clerks would pick up a scheduling request from a request list. So I can just show that quickly. And there are different ways of categorizing this, which we'll be figuring out during our scheduling design sessions. But the way that Vancouver Centre currently has theirs configured is that telephone care would start by inquiry of the ONC request list by location group, and then we choose a queue underneath that, which in this case, I don't have the telephone line one easily accessible. And you can see this is quite a long list, but basically we would select then the correct queue, which would probably for Prince George be something like telephone line care or something like that. And then there's a location group that's selected, and then we can find any relevant scheduling requests that are waiting on that queue to be scheduled. Just bear with me while I set up my presentation once again, and we'll go through a few design questions. So that concludes the outgoing calls demonstration. And just at this point, are there any questions related to that? I guess I have a question as to what types of calls are scheduled for outgoing calls.
It mostly would be just calls that we put in, like if somebody called in and we're worried about them, sometimes we will schedule a call later that day to check in, like if we're sending them to Emerge, like did they go to Emerge, how are things going? Or we'll book a follow-up call the next day or the following day, depending on what we think is needed.
Perfect. Okay. Okay. And that can be accomplished using Message Center. I think Anna kind of alluded to that already. I may have alluded to it as well. But within Message Center, we can create a reminder for the next day or even 2 days later for that same patient to receive a call back again. So that's possible to do via Message
Is
Center.
it possible to also do it for the same day? Like if we want to check in on them later?
Yeah.
Okay.
Oh, for sure. Yes. And I mean, in that case, you might opt to just leave that one appointment there as opposed to completing it,
Okay.
or that reminder, I should say, not
Yeah.
appointment.
That makes
Okay.
sense.
So I have a few questions for you at Prince George. So just starting at the top, do you ever request blood work or other diagnostics out of telephone care?
We do, but like that would be, we would have to, consult with the physician and
Yeah.
things like that. But yeah, if like we're worried about a patient, then we bring them in for an in-person assessment and they would have blood work and things like that done, depending on what the physician thinks.
Okay. So if you were to bring them in for an in-person assessment, that's done in general clinic?
Yeah, that's right.
Okay. And not scheduled, or do you schedule it to
Well,
general
we
clinic?
schedule it to ourselves if we have time, or we communicate with the ST or RT nursing, and if they have time, then they'll see the patient.
Okay. And currently clerical staff are not involved in this.
They are, like
process.
if we need a rec, then they'll do the rec for us, or
Okay.
if we, yeah.
Okay. So so the clerks might complete the requisitions, or nursing might complete requisitions.
I would say it's hardly ever that nursing does them. It's usually the clerks that do the
Okay.
requisitions, yeah.
And that'll be based off of the doctor's order?
Yeah.
Yeah. Okay. And so if the patient is coming in for that assessment, obviously they'll take their rec with them. Do you request prescriptions out of this clinic?
Yeah.
And would those generally be faxed in by the provider at that point, or does the patient come pick them up?
It depends. If it's like a triplicate type of prescription and they're in town, then we ask them to come pick it up.
Right.
And if they're out of town, we get it mailed, or if they're out of town, we can get it faxed. But sometimes we do fax over prescriptions that we are able to, even for in-town patients.
Okay. If it's an out-of-town triplicate, you will fax it to pharmacy and then mail the copy to pharmacy?
Yeah, that's right.
Okay. Okay. Does this slide spark any questions from anyone else on my CST team?
I guess I'm curious, and Anna, I know from Vancouver Center's perspective, really when we talk about scheduling, there is a pretty substantial workload associated with formally scheduling appointments in Cerner. And I'm curious, Anna, on your experiences in Vancouver Center, have you found a balance where you are scheduling a decent number of appointments using the scheduling function, or mostly using Message Center for that regard?
So currently with my team-based care clerk, we've developed a relationship where if there is a patient that I do need to follow up and do a telephone call, I'll book the order in for that at the expected window, and I'll just tell her verbally that I need this booked in 2 weeks for a subsequent number of calls, depending, and she'll be able to do that. However, if I'm on the phone line doing the logging, I don't really have a way of reaching out to every other clerk, because I don't know for sure which clerk is functioning with that team. So at the moment, whoever's the nurse for that team will reach out to their clerk and then coordinate any future calls.
Okay. Thanks very much, Anna. I appreciate that.
Okay. This slide is related to some of the requirements gathering that we need to go through for your clinic. So again, starting at the top, a scheduling book for PGTLC. Should there be, would we need 2 scheduling books or 1?
Well, I think just one for now. Yeah.
Yeah, okay.
Well, you make a
Because
differentiation between TLC 1 and 2.
Yeah, so this is kind of going on the assumption and the context that I come from in Abbotsford, where we have a TLC 1 who is the nurse completing the incoming calls, and then a TLC nurse 2 who completes the outgoing calls. So the outgoing calls being those pre-scheduled calls.
I think currently we just have like one nurse scheduled in the TLC clinic throughout the day. And sometimes like if it gets swamped, then we would add a nurse for support, but I don't anticipate that one would be doing incoming, the other one would be outgoing. So
Okay, that makes sense. And then with Message Center, I think we would go with one pool for your center as opposed to having RT and ST.
yeah, just one pool now.
One pool, okay. Is there a fax number specific for TLC?
No.
Okay, and is it the general clinic fax number that, okay, and would you receive any faxes or mostly be faxing out?
We'll just be faxing out like mostly prescriptions and scanning the requisitions. So yeah.
Okay, excellent.
Hey, it's Rochelle from Prince George. I feel like the TLC nurses use the chart prep fax a lot, not the general clinic one.
I personally don't use that one, but maybe other nurses do.
Yeah, because I've been working out of chart prep for the last week and a half, and some nurses do use it a lot for faxing out.
Thanks, Anna. I just see, or thank you, Rochelle, sorry, first of all, for that comment. I do see Anna's comment in the chat. So Anna, are you referring to actually being able to schedule in Cerner or just using that reminders function in Message Center?
I think the consensus with my other colleagues here, we've all kind of wanted now to have the ability to book those nursing call outs. I think some of my nursing colleagues are using Outlook for reminders for themselves for any patient care calls, as our clerks are quite swamped with their own workload. That's probably an internal thing that I can't really fix for them, but that's something affecting us.
Okay, and that is good feedback. I'm sure there will be more conversations around clerical workload and how to accommodate for that.
And Chelsea, I think that's what we would prefer here too. But again, given the clerical shortage we have, it's been working for us that the TLC nurse does her own follow-up schedule and book those appointments. So
yeah.
And then again, when you say to the patient, I'll call you back tomorrow, it doesn't specifically, we say like, oh, we'll call you at 9 o'clock. You know, we kind of put it in there, and then we move things around in our case schedule. Like, you know, say we did put at 9 o'clock and it didn't work, like, you know, and then we have to do something at 9, then I would move the 9 o'clock like to like 2 o'clock in the afternoon. So that's easy to just move around in case, but I'm not sure how convenient it would be in CSD. So that is one of our concerns. Yeah.
Yeah, I do hear your concerns and come from that background in my experience as well. It is nice to be able to control our own schedules and to know that the patient is booked in when we're concerned about them.
It's Arlen. Can I just ask a question of Anna again then? Just curious why you're choosing to use Outlook versus the reminder function in Message Center?
This was kind of adapted to us just recently since team-based care became live at Vancouver Center. And I think it was convenient for the nursing to just have it in their calendar Outlook, especially just other notes taking. It's just more in view, I guess. I don't know how to explain it.
Okay, I think it would be good for us to understand what you guys are finding challenging with that a little bit more, but obviously not right now, but
I can see how it could be like the reason why we would be using Outlook. like when you have like a case scheduled, then at least you have the schedule in front of you and you know those are the calls that you need to make. So with this one, if that schedule is eliminated, how would you know when you log in, when the TLC nurse, like, starts her work, other than like the messages that are there, like how would she know that these are the calls that she needs to make for the day is my question.
Oh, that's a question for me, or?
Yeah,
I
so I
guess
think
I'm-
Erin, really what we're talking about is there's two different solutions. So the option to formally schedule patients in Cerner, which requires clerical involvement, is what I'm hearing, and that gives you a sequence of here are the appointments for the day itself. In the message center pool itself, it really isn't intended to be a calendar-based function. It's kind of just here are all of the calls that need to be made, and sort of triage and do them as you can get through them. So I think it's about finding the balance of what appointments should be scheduled because there's a dedicated time set up with the patient in advance versus sort of what can be triaged and handled throughout the course of the day. And I think it'll be about finding that balance. Sorry, go ahead, Erin.
Yeah, no, thank you. I appreciate that feedback because it's true. Rather than bouncing between message center and ambulatory organizer, there might be a solution in between there that's actually better for your workflow.
Yeah.
I don't think we'll find the answer today. I do, again, want to be cognizant of everybody's time. We do have follow-up sessions for this, and I apologize. I intended to put the date for that next session, and I can't pull
February
it from
7th.
February 7th. Okay.
Yep. So we also have like scheduling sessions in the future, but I think the gap analysis session is February 7th.
Okay.
And then
Okay.
we'll have a validation session like for a couple of weeks out too.
So I think for our next session, thanks so much, Rena, for the date. Our next session, I think the priority should be on talking about the scheduling piece and how you actually want to manage that for your center. So I guess the question here at the top, I think we have an answer, is that there's probably functionality in the system that will work. It's just a matter of how you want to localize the workflow for yourselves. Does that sound fair?
Yeah, I think that seems fair. Yeah.
Okay. I don't think we have any specific parking lot items, but certainly for next steps, it will be to discuss those scheduling pieces. I don't think we have decisions requiring escalation because the functionality is available in the system. So we don't need to, doesn't look like we need to build anything other than once we complete those scheduling conversations, then we can move on with, the next steps in regard to scheduling. So that will conclude the presentation. Does anybody have any other questions, comments? All right. Well, I thank you all very much for coming. Thank you to